Welcome to Healthcare APPtitude, where healthcare's thought leaders will examine ways to address the rising costs of care in America. We'll also examine how the latest advances in mobile apps are helping hospitals and health systems bend the cost curve and improve patient engagement.
Welcome to Healthcare APPtitude. I'm Bruce Kennedy, Vice President of Provider Development here at Mobile Smith Health. Healthcare APPtitude focuses on the latest advances in healthcare's challenges and technological advances, such as mobile apps that have been designed to address those challenges. In this episode, I'm very excited to be joined by Paddy Padmanabhan, CEO of Damo Consulting and co-author of Healthcare Digital Transformation: How Consumerism, Technology, and Pandemic Are Accelerating the Future. The book was co-authored by Edward Marks, Chief Digital Officer of the HCI Group. And like many who have read this work before me, it is truly foundational for any healthcare leader, no matter where they may be in contemplation or implementation of their digital health strategy. Welcome, Paddy. How are you doing today?
Thank you, Bruce. Thank you for having me. It's a pleasure to be here.
Great. Paddy, can you talk a little bit about how you and Ed got together to create this work?
I've known Ed for a really long time, and he has been a client for many years in his previous roles as CIO for several large health systems. When he was the CIO of Cleveland Clinic, I and Ed worked together on putting together the enterprise digital roadmap for the clinic. So I worked very closely with him for a period of 6 or 7 months, and my firm did the work for the Cleveland Clinic, helping put together the roadmap. And while we were doing that, Ed and I would often talk about, hey, there is an idea for a book here, because all the stuff that we're doing together, there's others who could benefit from our best practices and from our insights that we're gaining through this process. And so about a year went by. He was at the clinic and he didn't have the time to write the book. And I was off doing other things as well. But in the middle of 2019, he left Cleveland Clinic and he called and said, why don't we write this book now? And so we got together, we spent about 6 months together, put the manuscript together, and we had actually submitted the final manuscript to the publisher in February, and then the pandemic hit. So we told the publisher to hold off on releasing the book so we could take a quarter or so to see how the pandemic was going to influence or impact the themes that we were talking about in the book. And we went back, we looked at all the work that we were doing. We talked to several people in the healthcare space and the technology space to understand how the pandemic was changing priorities, how specifically it was impacting the pace of digital transformation. And so we took all of that. We ended up rewriting several chapters in the book, and we also put in a new section in the first chapter in the book. So we made it as current and relevant as possible in the wake of the pandemic. And eventually, we released the book in August.
Yeah, it looks like you pretty much devoted the entire first chapter of the book to the pandemic. I mean, I know obviously the pandemic forced health systems to think about digital transformation a bit differently than they probably had before. But did COVID end up shaping this book from your perspective?
It did in some ways. The good news is that a lot of the themes that we had originally discussed and written into the book, they continue to remain valid. Nothing had really changed in terms of how you go about a large-scale, multi-year transformation process. A couple of things that emerged right out of the pandemic, and what I would attribute directly to the pandemic, is that number one, the pace of transformation actually accelerated. And we thought that maybe because of the pandemic, everyone was going to be super focused on dealing with the crisis, and they're going to let the transformation plans kind of fall to the side, at least temporarily, slow down, cut back on investments and all of that. That didn't happen. What we saw happening was that certain aspects of the transformation program, especially related to telehealth, digital front doors, and technology enablement for back-end infrastructure, many of those things actually accelerated because health systems realized that, number one, the pandemic has created a compelling need to have a virtual care model in place, because without that, you're not going to be able to see your patients. So it was kind of table stakes. So that was one thing we saw. And in fact, you will hear this often when you talk to people in the industry. what was supposed to be a 5-year plan became a 5-month plan. What was supposed to be a 2-year journey became a 2-week or a 2-month journey. You'll hear this all the time. And it is true. Health systems have compressed the timelines and accelerated their investments and implementation plans for certain aspects of digital transformation, specifically around virtual care models and telehealth models. So that was the one thing we saw. It was very, very clear. The other thing we saw was that certain new modalities had emerged directly as a result of the pandemic. One of them I can talk about is, the need for creating contactless or low contact experiences, because now the pandemic has made everyone afraid to go into a clinic, to go into a hospital, to touch anything, to come in contact with anyone. It's ironic, who would have thought a few months back that going to meet your doctor and coming in contact with your doctor would be a high risk experience, and yet here we are. But then the technology has again come to support health systems in their efforts to create these low contact and contactless experiences. And we see a lot of potential for those, and we see those being implemented and those programs being rolled out and expanded as we speak.
So Paddy, it sounds like from your perspective, there was a bit of reactive evolution, maybe versus strategic evolution, right? One of my favorite lines from your book, it is not technology that holds healthcare back, but the culture. Expand on that a little bit, because, for those of us who've been in hospitals and healthcare delivery environments for a while, that's a truism. And it's something you don't realize until you're maybe a couple of years into the healthcare space or care delivery environment, that you're sitting there banging your head against a wall going, I'm not sure why we're moving so slow on some of these things. And it is part of the culture. Can you talk about that culture and in juxtaposition with technology advancing within a pandemic environment?
Sure. Someone said to me once that transformation programs are 80% people, 15% process, and 5% technology. It's another way of saying don't start with the technology. Start with the people who are going to be using the technology and who are going to be impacted by the technology. So in this case, you're talking about patients, of course, who are going to be impacted by the technology, because the technology is going to enable the delivery of care in a certain way, and it's going to impact the way they access and consume care. But importantly, it is about how caregivers respond to the technology. Now, we have come off of a 10-year period during which electronic health record systems were put in place and created a lot of organizational stress. And really, when you talk about large-scale transformation programs that involve technology implementations, that involve changes to workflows, changes to requirements. So it's one thing to say, we're going to go telehealth tomorrow, but then you have to be telehealth ready to go telehealth tomorrow, which means that you have to make sure that your caregivers understand what technology you're using. You have to train them on it. You have to put in a bunch of protocols in place, because now conducting a patient visit over a video platform is not the same as conducting it in person. And then you have to take into consideration people's preferences. How do they want to conduct the patient encounters? How do patients want them conducted? And how do you support and help the patient? Very, very small things, right? The patient doesn't have a good bandwidth, good internet connection at home. How does a caregiver then take care of it so that we're not losing time? There's so much detail that goes into all this. So ultimately, caregivers, the ones who are the front lines of care, the ones who are taking care of patients, need to feel comfortable with the technology. So that's really kind of what we talk about at one level. At the other level, what we talk about when we talk about digital transformation strategy is that you want to make sure that organizationally everyone is aligned. And that is the more complex challenge in many ways, because if you're a digital leader in a health system and you've been mandated with rolling out this enterprise-wide digital transformation program, you want to make sure that your peers and your colleagues, whether they're clinicians or whether they're administrators, are fully on board. And this, takes me back to what Ed and I did when we were at the clinic. We actually worked with a cross-functional group of 50 or 60 individuals from across, different departments, different functions. And we worked very closely with them over a period of 6 or 7 months. And we went through a lot of back and forth. We went through a lot of dialogue and discussion. Ultimately, the roadmap that was put together had the broad agreement and concurrence of stakeholders that were going to be involved in implementing the program. So when it went up to the C-suite and the board, it already had the support of a large part of the enterprise. So it makes the job that much easier. So that's the other aspect of culture. Don't try to do it alone. Make sure that culturally what you're recommending, what you're putting in place aligns with how the organization does things, aligns with how people like change to be implemented, and understand all the puts and takes.
So in that case, or in that kind of environment, are you aligning culture, or are you changing or evolving culture, you think?
It's both. I think we are changing, undoubtedly, as a healthcare economy, as a healthcare system, because we are going virtual with care. And that is a dramatic change. And that change is going to be permanent for a significant portion of healthcare services. And when that kind of a change happens, people have to align around it and agree to it and be comfortable with it. And now it's the job of digital leaders to make sure that the degree of alignment that is required to roll out these high impact, high stakes programs is implemented well. We are already in the middle of the journey, and we are going virtual. And a significant part of care is going to be permanently virtual.
You're listening to Healthcare Aptitude on Healthcare Now Radio. I'm Bruce Kennedy. In today's episode, we're talking with Paddy Padmanabhan, CEO of Damo Consulting and co-author of Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future. Paddy, that is a great segue into the work that you and Ed put together in terms of defining digital transformation maturity models. The one thing I most enjoyed about this as a former healthcare leader is that no matter where you are in your digital transformation journey, you can drop into this book somewhere, right? You can find yourself and your organization within the work you've created and get something from this, something informative and substantive from this. Talk a bit about the digital transformation maturity models, the four you and Ed defined.
Yeah, this is one of the important chapters in the book, I would say. The digital maturity model is really foundational for an understanding of the current state of digital transformation, as well as sort of a benchmarking of where healthcare enterprises are today and where they could or should be. This is a 4-stage model, goes from model 1 through 2, 3, and 4, with increasing levels of maturity from 1 through 4. So model 1 enterprises are those that, very simply put, are defaulting to their electronic health record platforms for their digital transformation strategy as well. So if you have Epic or Cerner as an example as your electronic health record platform, if you're in model 1, you're essentially looking to all the features and functionalities available in your EHR platform, and you're going to drive your digital patient engagement through those native capabilities. So whether it is scheduling, whether it is video consults, whether it is patient communications, whether it's finding a doctor, all of that, you're going to do that through your EHR platform. Now, everyone acknowledges, including EHR vendors, that the EHR platforms cannot be everything for everybody in a digital future. And what you need in order to be able to deliver the kind of superior digital experiences that we have all as consumers come to expect based on our experience with Amazon and Apple and all these other companies that have excelled at creating these online experiences, is that you must therefore look to best-in-class tools and platforms that do certain things really, really well and integrate them into your EHR platform. So you're building on model 1. For instance, if you have a digital front door program where you're trying to create digital engagement, touch points using best-in-class tools, you would find the best-in-class tools in the market. They could come from a big technology firm, or it could come from a Silicon Valley startup with some VC money that is powering them. Regardless of where it comes from, if it's a best-in-class tool, you find a way to integrate it and bolt it on top of your EHR platform. So that's model 2. And then you go to model 3 and then model 4. And I won't go into each of the phases in between, but model 4 is really where you're a health system that is looking at digital transformation holistically. That means not just looking at the front end patient experiences and creating digital touch points, but you're also looking at the back end IT infrastructure that is required to enable these experiences. So that could mean everything from upgrading your data center infrastructure, maybe doing a cloud migration strategy, upgrading your data and analytics infrastructure, because that's going to power your digital experiences at the front end, upgrading everything, LAN, WAN infrastructure, upgrading your devices, and so on. Now, all of that, when you look at it holistically, will eventually make you competitive, eventually enable you to deliver the kind of seamless front end experiences that consumers have come to expect. And those seamless front end experiences will also take into account emerging technologies that will transform the experience. An example of that being voice, for instance, voice recognition, AI, and quite a few other things. But all of that holistically forms your digital transformation strategy. And entities in Model 4 are really committing themselves at an organizational level, committing very large multi-year budgets and staying the course. One of the interesting things that I've found working with my clients is that the health systems that are in Model 4, they have not allowed themselves to be distracted by the pandemic. They have, obviously responded to the pandemic and making sure that they're able to take care of their patients and, riding it out. But they have not taken their eye off the ball when it comes to the future state and when it comes to the commitments that they've made for their multi-year platform journeys and roadmaps. And they're moving forward with it. In fact, in some cases, they're even accelerating it because there's some tangible benefit to be achieved by doing that.
Thank you for going through that in the level of detail that you did. I wanted to make sure our listeners understood the significance of the way in which you define those 4 models. When I first read the book, I had to pull myself out of looking at them solely as stages, but models of operation, right? That you can be at any one of these model levels. And, perhaps you could, as a healthcare system, exist in model 3 for a bit of time, and you may never get to model 3 or model 4, but you're just really perfecting model 2. Would that be accurate?
Yes, and this is an important point. Not everybody can or should aspire to be in model 4 right away. It may not be the right time for your enterprise. We have 5,500 hospitals in the country, and there isn't a single size that fits all of them. The maturity model is just meant to guide you in your journey. But at least aspirationally, it's important to know that if you're in model 1 today, it's important to know that the significant parts of the rest of your ecosystem that are in one of the other models, with the most advanced enterprises being in model 4. But like I said, if you're a small regional health system serving a small population and you have some very immediate needs related to telehealth, and that's going to be fine for the next 2 or 3 years, then stay with it. You don't have to necessarily go out and spend tens of millions of dollars in putting in place a Model 4 roadmap, because quite frankly, that may not be the right strategy for your enterprise, and you may not get a lot of support for it from the board either. So your specific context is very important, but aspirationally, you have to know that the most advanced enterprises in their digital transformation journeys are at Model 4 today, even though it may not be where you want to be in the next 12 to 18 months.
Great. So Paddy, we're going to go ahead and make sure that we list the location and the website where our listeners can get your assessment tool.
So you can go to my website, damoconsulting.net. The assessment tool is not on the website yet. So if you really want to run the assessment, write to me, Paddy at damoconsulting.net, and I or someone from my team will reach out to you and help you do the assessment. The tool itself, we're putting it in place. Our developers are working on it, and so it's going to take a couple of weeks. So once it's up there, then you can go in and do it yourself.
Great. Thank you for that. I wanted to make sure we got that in. So Paddy, we referenced this idea of traditional versus agile digital transformation a little bit earlier. in this segment. Can you begin to walk us through the way you approach it in the book and what that means in terms of rolling out a digital strategy?
Yeah, the term agile itself is usually used in the context of software development. But in the book, we are using agile in more of an organizational construct. So in the normal course of implementing a digital transformation program, you have to be really agile in responding to marketplace needs. And why is that? Because the marketplace is changing very, very rapidly. The competitive landscape for health systems has never been more in flux than it is today. And health systems have never had a reason to change, never had a reason to go into accountable care or alternate payment models or digital patient experiences. But now the marketplace is full of newer players that could be other traditional enterprises like a Walgreens, Walmart, CVS that are coming into the traditional healthcare turf, if you will. I like to say that COVID-19 has been a great equalizer because COVID-19 now has clearly tilted the marketplace in favor of digitally enabled enterprises. So the digital first healthcare providers that are emerging may now find themselves in a level playing field when it comes to certain aspects of care, like primary care, as an example. And then you've got the big tech firms that have been circling the wagon for a while and now are making significant investments and getting deeper into the space. You saw that Amazon launched this Halo wearable, which is really a way for them to provide some wellness services, but that gets them a little bit closer to more traditional healthcare, if you will. So it really creates a marketplace that is changing dramatically for traditional healthcare enterprises. And with the significant percentage of ambulatory care, specifically primary care, all set to shift towards a virtual care model, you have to be agile. You have to look at what is happening in your marketplace, and you have to make the kind of investments that will make you competitive for the future, that will continue to maintain your relevance in the market, continue to maintain your relationships and your loyalty from your existing patients.
One of the aspects of the book that I greatly appreciated was the level of attention that you paid to caregivers in the digital transformation process. And I think a couple of things that we've learned over the last 10 years in terms of digital transformation is that caregivers, especially providers, have kind of gotten lost in that process. And I like the fact that you and Ed addressed that a bit in the book in terms of a digital transformation strategy. It appears that no matter what size health system you are, in your strategic plan, there are two elements there. One is caregiver or provider compensation modeling, and the second is going to be provider satisfaction. Talk a bit about how you and Ed look at making sure that caregivers, providers particularly, do not get lost in that transformation process.
This is very important. There's a great point that you bring up, Bruce. If you talk to the insiders in the healthcare industry, you know this. You cannot deliver superior patient experience at the expense of the provider experience. You cannot do that. The providers have to be enabled to be more efficient, productive, and to get all the benefits of the tools that we are deploying so that they can do their jobs better. And that in turn influences the quality of the experience for the patient. So great patient experience, hugely important for sustained competitiveness and an existential issue. At the same time, cannot be done at the expense of the provider experience. That's really what we're trying to say.
Great. I want to finish up with one final question, and it's in regards to the monetization of these new digital platforms that hospitals are either creating or becoming involved in. I think you know as well as I do that hospitals are very bottom line focused, cost containment focused, right? And I think that what you and Ed do in this book is begin to look at, okay, these digital transformations will drive a level of cost containment and efficiency. Obviously, it's what they're designed to do, but you also focus on top line revenue growth and selling innovation. So talk a little bit about that.
Yeah, there's an interesting set of dynamics at play here. So my firm did an analysis of the financial results of, I think, some 15 different health systems for the first 2 quarters of the year. And we found that most of them had seen a significant decline in operating income compared to the corresponding period in 2019. No surprises there because of the pandemic. So one of the big reasons is obviously the increased cost of responding to the pandemic, PPE and other costs. The second one is the loss of revenue because of the suspension of elective procedures, which are very profitable for health systems. And the third one, which we found very interesting, was a decline in returns from their investment portfolios. Now, that goes to tell you how much over the years the large health systems have come to rely on non-traditional sources of income for their bottom lines. The healthcare business has always been a low margin business, and in a continued fee-for-service environment where the reimbursements are going down or under pressure, you're going to see those margins being compressed. Now, that's a whole separate topic, how much of that is going to shift to an alternate payment model and when. But if you take just one simple example, now, even though telehealth reimbursements, the waivers are in place and they were quickly put in place by the CMS, and a significant portion of your in-person visits have shifted to telehealth, the fact is that what you're getting reimbursed today is not adequate when compared to what you would get reimbursed for an in-person visit. So there is going to be an ongoing pressure, despite the fact that there is no alternative. You have to go telehealth. But what this raises is an important question, which is how do you really create a financially healthy model that is sustainable for the future? So one way to do that is to monetize your other assets. The one asset that is being increasingly monetized is data. The other way that health systems are now looking at it is, turning their brands into related services, maybe, wellness services, and expand into that space. There's a whole range of technology services that health systems can now offer to others. And we are aware of a couple that have actually gone out and decided and declared their intent to take all of the internal capabilities that they've built, and they want to offer it as services to their peers in the industry. They want to monetize it because the need eventually is that you have to somehow compensate for the low margin core traditional healthcare services business with other sources of income in order to keep up the bottom line so you can continue to invest in the future, but also because it is an opportunity. So in both ways, you're going to have to find alternative revenue streams in order to remain relevant in the future. And that is what is already playing out. And that's what we refer to in the book as well.
Thank you for your time this morning, Paddy.
Thank you. It was a pleasure, Bruce.
Well, that's a wrap for this month's episode of Healthcare Aptitude. Be sure to join us next month as we investigate more about the use of mobile apps in healthcare. Remember to catch the show on Healthcare Now Radio every weekday at 7 a.m., 3 p.m., and 11 p.m. Eastern Time. For more information, visit www.mobilesmith.com. Send your questions to sales@mobilesmith.com. Thank you for listening and be safe out there.
Thank you for listening to another episode of Healthcare Aptitude, sponsored by Mobile Smith Health. Be sure to tune in weekdays at 7 a.m., 3 p.m., and 11 p.m. Eastern Time on Healthcare Now Radio.